everyone. I'm here with Dr. Joe Davis, and he is a reproductive endocrinologist out of the Cayman Islands. I guess it's so exciting. And so what we're talking about today is endometriosis. And endometriosis, it can affect women of any age. And so he's going to share a little bit about how and what that means.
Yeah. So, well, thanks for having me today. This is great, and a topic that's so important to women's health in general. The endometriosis affects about 1 in 10 women, and a lot of women don't know that they have endometriosis. They may have really, really painful periods, missing work, needing to take lots of pain medications, and don't realize that that's abnormal, and that's not it's something that you should definitely see your doctor about, because you may have endometriosis. And why is it important? Well, obviously having pain is difficult to function, difficult to go to school or go to work, but it also can have impacts on your fertility. It can affect your ability to get pregnant in the future. It can also affect your eggs and your egg quality, which is important even if you're not trying for pregnancy now, but it could have effects on your future attempts at pregnancy.
So what would be some of the key warning signs that if you had some of those symptoms, you should check or ask your doctor about endometriosis?
So the most common symptom of endometriosis is very painful periods, but that's not all. A lot of women may experience pain outside of their period. A lot of women actually have, because endometriosis causes inflammation, it can lead to scarring and things sort of all your, things sticking together essentially, which can actually lead to having pain when you have sex. Some people have positional pain, certain positions hurt more than others. Some women will develop cysts on their ovaries, which can become painful. They can have pain on one side, even outside of their period, and those are signs to seek some advice.
And then what treatment options are usually available?
So it depends on what the goal is. With endometriosis, unfortunately, it's a lifelong symptom or a lifelong situation. So a lot of women end up needing either to suppress the hormones that make endometriosis worse, which if you're not trying for pregnancy can be done with birth control pills. But if you're trying for pregnancy, then obviously being on a birth control pill is not helpful. Right. But there are ways to preserve your fertility moving forward. Egg freezing is a much more robust option that we didn't have years ago. And so women who do have endometriosis, who aren't ready to be pregnant, may consider freezing their eggs as a way to say, okay, in the future I want to make sure that I have the best chance to be pregnant, and I know that endometriosis is going to have effects on me throughout my life and my reproductive life. Let me do something now proactively.
Great. Okay. So painful periods and maybe intercourse that is painful, those are some key things that they should ask their doctor about, and not be scared to talk to their physician about those things, because that could be part of the situation that is keeping you from getting pregnant or infertility. So when you freeze your eggs and you have endometriosis, or you've officially been diagnosed with endometriosis, how is that going to help? Just because it delays the pregnancy, and you can do that outside of the body?
So there's a couple of benefits of egg freezing for endometriosis. Because endometriosis is lifelong, you can have a bigger effect of the endometriosis on your eggs as you go through your reproductive years. So for women, we know that they have a limited number of eggs for their lifetime. Women with endometriosis may have fertility problems earlier than they would have expected based off their age. So freezing your eggs allows you to preserve those eggs in the event that you do have difficulties in the future. Part of the other side of it is that a lot of these methods to treat the pain and the symptoms of endometriosis involve either birth control or hormones to suppress the estrogen that your ovaries make, and all of those are prohibitive to getting pregnant. So if you are worried, you want to treat the pain, you want to treat the endometriosis with medical therapy, freezing your eggs in advance means that you don't have to be as concerned about your future fertility. There is also treatments with surgery that can be beneficial. There's some definite pros and cons to having surgery. It's invasive. It has effects immediately on fertility, but may not have benefits in the long term for fertility. So another thing to be mindful of is doing surgery to help with endometriosis pain can be helpful for fertility now, but if you're not ready to be pregnant, freezing your eggs, waiting till the future surgery still may be an option in the future, but you don't want to necessarily put yourself through a surgery in early years if you know that you're not immediately trying to get pregnant.
So you could use those hormones to suppress it when you're not trying to get pregnant. But then when you are trying to get pregnant, is the embryo going to stick, or do you have a less chance of the embryo implanting in the uterine wall?
So there definitely is impacts of endometriosis on the ability of the embryo to implant. So when you do try to get pregnant naturally, one of the challenges with endometriosis sometimes can be the ability of the fallopian tube for the egg and the sperm to get together to create an embryo, and that to travel down the tube and stick to the uterus. But if women have either frozen their eggs or undergoing in vitro fertilization in the future, then those embryos that are created, when you put the sperm and the egg together and make that embryo, it may have difficulties implanting, which is something to be mindful of. And especially if you have endometriosis and you're thinking about your future fertility, a lot of women are freezing eggs that don't have endometriosis may not need to freeze as many eggs, whereas women that have endometriosis may say, gosh, when I do use these eggs in the future, there may be some challenges, even though I've frozen my eggs, maybe I should freeze more eggs in advance just to be safe.
Because in the embryos, you might go through more embryos than normal because of the implantation.
Exactly.
Okay.
Yep.
All right. Well, that's good to know. So if you do have endometriosis, then you should try to freeze more eggs or think about your reproductive health a little bit differently.
Correct. Yeah.
Okay. All right, that sounds good. Well, any advice for women that have endometriosis? Is there any like treatment options that are more natural or holistic?
Yeah, I mean, because endometriosis at its core is inflammation. It's the lining of the uterus, or the part of the uterus that comes out when you have your period, but in a place it's not supposed to be. That could be the tubes, that could be the abdomen, that could be lots of different places. But all of it basically affects inflammation. So there is some ideas of saying, well, what if I can do something in my diet or my lifestyle that's going to reduce that inflammation? So trying to avoid trigger foods that tend to be pro-inflammatory, and there's no particular diet that's been shown to affect endometriosis, but there are definitely people who will report better symptoms, especially maybe even with a gluten-free diet or avoiding certain foods that they know that afterwards their pain is worse. Say, okay, maybe make a diary of what you're eating, avoid those trigger foods, try to kind of, balance that out with lots of, healthy things, fruits, vegetables, just really trying to eat an organic, healthy diet. Also, endometriosis can, because of the inflammation, can be impacted in a positive way with acupuncture.
Oh, wow.
A lot of people are using acupuncture as a way to reduce inflammation, and anecdotally, a lot of patients report benefit from their pain after acupuncture. I've even had a lot of patients say, they had lots of pain, they did acupuncture for a certain period of time, and immediately got pregnant because it was able to shift the balance away from inflammation into more of a natural state. So definitely something to also consider if you're open to it, is considering acupuncture.
Now, is PCOS technically also endometriosis, or a form or stage of getting endometriosis?
No, PCOS seems to be a separate thing. It's also a very common condition that affects women. PCOS, for the most part, is sort of in a spectrum of metabolic conditions that impact the way the eggs grow, the way the body sort of goes through the life cycle of the egg. It definitely has huge impacts on your ability to get pregnant, your fertility, but endometriosis seems to be a slightly different entity.
Okay. And is there any hormone effects if you've been on birth control for a long period of time? Could you realize you had endometriosis that was just being masked by the birth control?
Very common. Yeah, a lot of women, especially young women who have pelvic pain, they have painful periods, they're missing school, they go to their doctor who says, oh, you just need to be on the birth control pill and that'll take care of it. Many, many years down the road, 15, 20 years later, decide they want to have kids, they come off the pill, and their endometriosis is at a very severe stage. It can be helpful for reducing the symptoms, definitely, but it doesn't eliminate endometriosis. So things to be mindful of is if you have pelvic pain, see your doctor. If your doctor doesn't really, seem to be too concerned about it, it's never a bad idea to get a second opinion and say, hey, this is more than just a little cramps. This is some significant pain. It's something to be looked into. And if that's the case, being aware that you have endometriosis means when you're thinking about your fertility in the future, you've already got that knowledge to say, okay, I might have some more challenges than I otherwise would have unexpected, I'm going to be proactive. I'm going to, seek help a little bit earlier. I'm going to check my egg numbers, either my AMH blood test, which can tell you an idea of your egg numbers, or even an ultrasound with your gynecologist to see, do you have any cysts or any other problems.
That's a good idea. Okay. Well, you can learn more all about how can they get a hold of you.
So I'm at Grand Cayman, so I'm the head of the Cayman Fertility Center. You can find us online. So the website is Barbados IVF, which is the affiliate practice that I work with. And
then you have your own personal website, right?
I do. So drjosephbdavisdo.com, and that's a link directly to me. It has some information about what I've done, some educational information, as well as some articles if you want to read more about different topics, including endometriosis.
Great. Well, thanks for tuning in.